Well, the one thing that would see a swift end to lockdown regulations here and around the world is a vaccine. It would literally change life as we've come to know it. But how viable is this? Mia Malan is the editor at the Bhekisisa Center for Health Journalism. She joins us now. Mia, good evening to you. Thanks for your time once again. Why do vaccines have a certain timeline? Why do they take so long to develop? Why can't we just, get one tomorrow or in 6 months?
Well, it's because there are so many steps to go through, and because it also takes a really long time to make sure that trial participants are exposed to the virus in society in a natural way, as opposed to, putting them all in one room and lock them up with an infected person, which wouldn't be ethical to do. So most human trials go through several phases, usually 3. The researchers first need to establish if the candidate vaccine is safe, because there's really no sense in finding a vaccine that then causes a host of other medical problems. To give you an example, in 2004, when researchers tried to find a SARS vaccine, scientists found that one candidate vaccine caused hepatitis in ferrets, and they then had to stop that trial. Now, once safety has been established, things get pretty interesting, because you now need to take a group of people and split them into 2 and give one group the candidate vaccine and the other one a dummy vaccine, so that you can compare the results. And then researchers first need to wait for people, once they inject them with that vaccine, they need to wait for people's bodies to respond to the vaccine. So in other words, to develop antibodies, and that often requires 2 or 3 shots of that candidate vaccine. And then they have to wait for those trial participants to get exposed to the virus. Now, that can take a really long time, because we don't yet live in a world where large proportions of society has contracted the virus. Large proportions meaning 2/3 or more. So someone needs to go out in society, and we need to wait for them to get infected. Some people, in the case of diseases where there's treatment for, have argued that we can speed up this process by, for instance, doing it putting people in a room with an infected person and let them get infected in a faster way, so that we can get trial results in a faster way. But that would not be ethical for the new coronavirus, because we would in effect be exposing people deliberately to a virus for ways that can be lethal and for where there's no treatment. So that would not be ethical in this case.
Okay, there's so much to consider, so much work to do. Do we have to start from scratch, or are there other coronaviruses? And I mean, along with that, it's called COVID-19. Is that because there's a COVID-18 somewhere as well?
Yes, there are indeed other viruses. So COVID-19 is a disease that the new coronavirus causes, and that virus is called SARS-CoV-2. And all the coronaviruses start with SARS, and then they have something behind them. So 2 other coronaviruses have caused lethal outbreaks before. You would be familiar with SARS that we had in China and elsewhere, and also MERS that was mainly in the Middle East. And vaccine research went ahead for both, but none of those vaccines have been licensed, in great part because in the case of SARS, it just fizzled out, and MERS was a regional outbreak, so it wasn't worldwide, and that need wasn't so urgent. But one of the concerns with coronaviruses is that we don't know if, in the case of the new coronavirus, whether the antibodies that we develop trigger long-lasting immunity. For instance, about 1/4 of common colds are caused by human coronaviruses, but the immune response fades so quickly that people can become reinfected the next year. So what we don't yet know is if we can find a vaccine, whether that vaccine will be a once-off shot that will last forever, or whether we would need to get several shots to be able for it to work continuously.
Okay, so I mean, for example, there's an annual flu vaccine, because flus change. They're also sort of related to coronavirus, as I understand. So could we end up with something like that, some sort of regime where you actually go pretty often for your COVID-19 shot?
So right now, the answer isn't that clear. There's some indication that the coronavirus we're dealing with now doesn't change very rapidly, so it doesn't mutate very fast, like, for instance, HIV. So a vaccine might work indefinitely, but as I've mentioned, researchers don't really know how long immunity with this virus lasts. So we may need to get booster shots, so not a different shot each year necessarily, but a booster of the same shot to make the vaccine actually work for multiple years.